Welcome to PM Personality Profile. My name is Nana Ansakwao IV. My personality today, his father used to make sculptures. His mom was a local entrepreneur, a Makola woman. And what did he grow up to become? A cosmetic gynecologist, Dr. Akwesi Deborah. You know, I really want to talk to him because I just want to find out what their whole world is about. I mean, I have a bit of a bulge and they suck some out. I have a bit of a flat back and they add some on. Is it safe? Dr. Akwesi Deborah, thank you very much.
Oh, thank you, my brother. Well, I went through the rotation, typical housemanship at Confirmatory Teaching Hospital. Did my OB/GYN rotation, my surgical and medical rotations, and when it was all done, I took the qualifying exam to enter residency or training in the United States, and I passed that, and then went over to the U.S. and you know, took me about a year or so. Eventually, I got into residency at Howard University Hospital, and initially I did a transitional year, which is a rotating internship, you know, from department to department, you know, just to get a flair of what's going on. Because, you know, the training in Ghana is strong in terms of the academics, but there's certain things that at that time because we had only read about in the textbooks, so it became more practical, and I just needed to get used to it. So in the long run, I started, you know, I did a transitional year of 2 years in internal medicine, and then I eventually did obstetrics and gynecology. And so after the obstetrics and gynecology training, I went to practice, you know, in Richmond, Virginia, for a couple of years. But I started thinking about, you know, what happens when you get older, or as you know, mature in healthcare. What do you do? Because, you know, in America, unlike in Ghana, the doctor is the one who catches the baby, you know, and you don't leave it for anybody, you know. But in Ghana, you know, you get the nurses to do the deliveries for you, and when it becomes complicated, then, you know, the doctor comes in. So so I thought about...
But in America, the doctor has to do that?
The doctor is the one who's doing the delivery.
Wow.
Yeah, the Americans believe in getting paid for what you do. You see what I'm saying? But it comes to it. I mean, yeah. And so I then enrolled, whilst I was in practice, I enrolled in business school at the College of William and Mary in Williamsburg. And I did an executive program.
In business school?
Yes, business school, yeah. So I did an MBA, you know, in executive MBA, College of William and Mary. So when I completed that, I started looking at options in terms of, you know, where I want to be. And so from that point on, I started looking at options. What do I want to do? Medical management, you know. Do I want to go into pharmaceuticals? You know, like working with Pfizer or, you know, whatever. But I actually did part-time work with the Blue Cross and Blue Shield, where I was medical director for, you know, case management, you know. And it wasn't as fun as I thought it was going to be. And then I looked into pharmaceuticals. Then eventually I decided that it would be best to get into you know, hospital development as, you know, as a future. And so I put a group together, and we set up an outpatient surgical center that is called Forbes Ambulatory Surgical Center. So I put the team together and we set it up, and, you know, and we're still operating that right now. So what happens typically is that there's certain procedures that you can do on an outpatient.
Okay.
that is same-day surgery. You know, and there's certain procedures that you need to be put in the hospital. So if you're going to do a procedure that can be done at a same-day surgery, then we take you to this facility, we do the procedure, and then you go home. You know, and that becomes an easier process because, for one thing, the number of hospital beds get smaller and smaller. You know, so because of the population, relative to the population. So we're always trying to take as many patients, outpatient surgery, and then, you know, they go home. So after a couple of years, I started thinking about cosmetic surgery because one of my friends who did internal medicine, you know, went and acquired additional skills to do cosmetic surgery. And he's in New York. So he invited me. I went to look at his practice, and, you know, I went to it's like became a mentor for me. And we're doing liposuction, body sculpting, essentially. That's what it is. So with that knowledge, I did a formalized training with Jeffrey Klein. You know, he's in California. You know, he has a program that you go and, you know, they give you didactics, and then you you know, you gain experience from the lectures, but you still have to come back and practice on patients. But that practice usually involves, you know, working with another doctor to get experience. So after one becomes comfortable, then you can move ahead and take cases on your own.
I mean, from moving from gynecology to, you know, so 1 minute you happen to give birth, and now the next minute you're shaping the bodies. I mean, was it a huge step or was it a natural step?
It was easy in the sense that for me, doing my transitional year in the residency, I did a lot of general surgery. I did intensive care unit management of surgical intensive care unit. I did a rotation in the cardiac care unit, you know, where people have heart attacks, and we manage them. So with that combination, I became well versed in managing very, very sick patients.
Okay.
And I also did quite a rotation in an emergency room. So my background gave me enough experience to pretty much manage any complex situation. So with that kind of training and with the obstetrics, it became, I was at a point in my career that I had acquired enough experience to be comfortable with this. And when I started working with my friend doing some of the procedures, I think at that point the artistic part in me just started coming out. I was looking at things different because, you know, if you don't have the eye for the beauty and the eye for symmetry and the eye to look at stuff, it makes it very difficult for you to achieve what you need to achieve. Some of the stuff just comes natural, you know. So what had happened was, at some point in my career, I then decided to stop doing obstetrics on my own. I was just teaching obstetrics. So I'll teach the residents. And then when I quit obstetrics in my practice, I had a lot of time on my hands to be able to focus on the cosmetic surgery.
What are our main worries? And is it the same as in America, or they have different worries? I want to know what our worries are first.
A lot of people want flat tummy. Men, women, they want flat tummy. Then a lot of people want youthful breasts. You know, And then we come to the new A shape behind. You know, they call it the baby gut butt. You know, or Brazilian butt lift. You know, I mean, most African, you know, women have a good shape in their behind. But sometimes what happens is that because of poor dietary habits, they lose that shape. And most of the time, what we really do is to redistribute the fat, and that brings their shape back. Because structurally, everything looks good. We just need to take fat from the sides and the back, and now they have perfect shape. Every now and then, some women will have a little dimple or a little dip in the middle of their sides, and then we may have to put in some fat to get the curve.
If let's say I had liposuction, I mean, could I get the pot belly back, or that's a permanent solution?
The two areas of fat we're talking about. One is the fat just right under the skin. The one is fat that's inside the abdomen, right around the intestines. The fat around the intestines comes from poor eating habits. And that fat, when it comes in, gets pushed out and gives you your pot belly. If the fat is restricted to the area under the skin, yeah, we can take care of that, and you see your six-pack. You know, and once you have your six-pack visible and you work out, you can keep a lot of the protrusion or the push from the fat inside your belly. You know, so you can have a flat stomach.
Well, that's what I need. Mine is definitely under the skin, so yeah, that's what I need. Now, when we come back, we want to find out, is it safe? Don't move.
All right.
But look, is it safe?
Sure, it is safe. It sure is. Like any surgery, this is elective surgery, and it's not an emergency. When the patient comes to see me, I make sure that I take a good history, make sure there are no medical issues that are red flags, and then I do some lab tests to make sure that we're not going to run into problems. We look at the kidney function, the liver function, and we look at the ability for their blood to clot. So those are the three important areas that we look at. During the procedure, I always have a monitor on their finger to check their oxygen saturation.
I see. Doc, now we've established it's safe. Now, G-spot rejuvenation. Let's just briefly educate me. What do you do? Move it to a different position, bring it forward? You know, what do we do with it?
Well, we call it G-spot enhancement.
Enhancement.
Now, typically, now, is this content for adults, or is it we have kids?
Yeah, this content, it's 9 p.m.
All right,
it's 9 p.m.
All right, so the kids are asleep, so
yeah.
we can talk. We can really talk language. All right, so typically the G-spot has a location behind the pubic bone. Okay, you enter the vagina and you move up a little bit anteriorly. It's an area called the G-spot, and typically during sexual intercourse, there's just one position that you can directly make contact with the G-spot, which is moving from behind to the front. And so what happens in the G-spot enhancement is we actually introduce a gel under the surface of the G-spot location to create a little bleb or a little bulge.
Push it out a bit.
Exactly. And when that happens, any penetration into the vagina orifice makes contact with the G-spot. So if you haven't had, so there are two types of orgasm. There's clitoral orgasm and G-spot orgasm. So if you haven't had a G-spot orgasm before, you've tried, we cannot make a G-spot orgasm happen. See, because that area, there may be a problem there that we can't fix. But if there's no problem there, all we're doing is just making it more accessible. That's really what it is. And folks swear by it. They're really excited when they get it done. This is like a 15-minute procedure we do. We don't have to put you to sleep.
Vaginal rejuvenation.
Yes.
So what do you do to it then?
Well, vaginal rejuvenation is an umbrella term for people who, remember now, I'm a cosmetic gynecologist.
Cosmetic gynecologist.
Right.
Okay.
So there are certain areas in gynecology that folks want to enhance. You see what I'm saying?
Okay.
They say men are visual, women are oral.
Yeah.
So they want the men to see the stuff so they can get excited about it. So whatever they need to do, if it's the breast, they need to shape nicely. Sometimes it helps. Not sometimes, a lot of times it helps. If you look at the outside of the vagina, for some women, we call something labia majora, or the external lips. If it loses fat, if it becomes too long, for some people, they think that it's not attractive. Because I'm sure when ladies go around, they look at their friends, in different situations, and they see what their friends have, and they say, I like this one, or they look at movies and, things like that. So when the external labia is too long and flappy, we can reduce the size. If it's lost fat, we can actually transfer fat into that area to cover the external orifice to make it very youthful.
Doc,
and attractive.
Before I forget, if you haven't had babies, can you have lipo? If you haven't had a child yet, can you have lipo or tummy tuck?
I wouldn't recommend tummy tuck for someone who's trying to have a baby. But liposuction, you can have liposuction and have a baby. It shouldn't be a problem. Yeah, that's really, liposuction. You can have liposuction. I've had several people come to me that's liposuction.
Even though they haven't, and
they have babies later.
So
it doesn't harm anybody at all.
I mean, I knew I won't be able to cover all my curiosity today, but Doc, you come to Ghana 4 times in a year?
Yes.
And then you'll be at the Center for Cosmetic Surgery in Ghana.
Yes.
And what's that?
It's over at Airport Women's Hospital.
Okay.
On Aviation Road before you get to the mosque, and we position ourselves in that environment because we know that women need mommy makeover. After they've had their babies, the bodies, may have gone through changes, and they need rejuvenation of their body, really. So that's the mommy makeover, where if we have to do a breast lift, we do that. If we have to tighten the saggy stomach with abdomen, we do that.
So how do you approach your surgery in Ghana? And so you see them on the first visit and then treat them on the second visit, or because you come 4 times in a year, so I'm wondering how you're able to get your patient, look at them and treat them. How do you schedule it?
Well, I have a patient care coordinator who is based here, and she communicates with the patients, and the patients communicate with me whilst I'm even in the US. And the ones who are serious typically would come to see me for consultation on my visit. If they come in early enough and they don't have any risk factors, I let them do their lab work and we can schedule them for the visit whilst I'm here. If they come too late we schedule them for the subsequent visit, because remember, there's no emergency here. We just want it to be safe. We just want them to be happy. We don't want any complications, you know. So that's really how I set it up. So they call the number, they make an appointment, and we're able to see them. And if they can be done the same day, usually the fillers, the Botox, we can do the same day. So they come in, we have it in the fridge, you know, and if they decide they want it, we don't have to do any lab work, you know. It's just, you know, we do it for them.
Sorry, I'm bombarding all these questions. Silicone implants. I mean, do you do silicone
Yes,
implants?
We do saline and silicone implants. They're safe.
They're safe.
Yeah, they're safe.
Sailing.
Yes, salt water.
Oh.
And then salt water. We put in the it's a silicone shell.
Okay.
We put salt water in it, and then we do implant.
Okay.
Yeah. So they're safe. They're safe.
Are we doing that in Ghana? Or?
Yes. Yes. We're doing that in Ghana.
Can you breastfeed if you've had the implant thing?
Of course. What it is that the implant goes under the muscle.
Okay.
And breastfeeding and the breast milk really comes from the glands.
Okay.
So the gland is on top of the muscle, so it doesn't interfere with production of breast milk at all.
I see.
Yes. So it's safe.
I'm sure the guys at home, you know, thinking, because they're all, you know, wondering all these things that, all these things that I'm wondering. What do we get more? Do you get more reduction or more, you know?
I get more lifts.
You get more lifts.
Yeah. The breast is sagging. They want it to point. You know, that's what I get more. You know.
Look, once you put this implant in there, is the milk safe? Is it not going to contaminate? We hear all these stories. We don't want any saline. We don't want the babies drinking saline.
Saline is salt water. You know. So once the saline leaves the sac of or the envelope, then the breast deflates. You know, it's not. But you know, it doesn't. You see, remember, the milk is coming from the glands, you know, and the saline doesn't really
have any connection.
Yeah.
Doc, do you enjoy? You sound like you enjoy the job. It must be an interesting job.
Well, you know, I enjoy what I do because I give people. I try to give people what they're looking for, and when I see the smile on their face, you know, it brings me pleasure. You know, I'm really excited that, you know, they like what I do for them.
Folks, Dr. Kwesi Deborah, cosmetic surgeon. It must be a really fun job. You know, get women come up to your office, carve them out, they turn up 2 weeks later, they are much prettier than they turned up before. It must be very, very fulfilling. Doctor, thank you very much for talking to us. And until I come to you next Friday with a different personality, have a wonderful, wonderful weekend. But I have enjoyed this interview. Thank you.